Someone might be thinking, I don't have heart disease. I was only diagnosed with something else, and yet that may be.
There is a higher predilection for men to suffer heart disease in comparison to women. In men, it's usually from the age starting from above 40, and then we tend to see cardiac events in women past menopause. So from around 55 to 60, around there. One of the reasons why ladies have better heart health outcomes is because they have what is known as better health-seeking behavior.
This is the Med Squad podcast. We get candid about these conversations and we speak from the heart. No pun intended. Welcome to the Med Squad podcast. Now, you probably don't know, depending on your age, you probably don't know him, but you can Google him. His name was Fred Sanford, an old man whose son used to give him lots of trouble, or at least that's what he said. And every time his son did something that he did not like, he'd get melodramatic and touch his heart and say, "This is the big one, Elizabeth. I'm coming to join you, baby. I'm coming to join you, honey." This is a bit more serious than that. And he was a fictional character. We're going to talk about real life. And I'm going to talk about heart disease. My name is Yafesi Musoke, and I'm not the one going to talk about heart disease. We're going to talk to an expert here, Dr. Tayo, who's a doctor specializing in internal medicine, and is here to actually help us speak about this matter of heart health because it's one of Africa's fastest growing killers. So why is it that heart conditions like heart disease, why is it on the rise in Africa?
Okay, so first of all, pleasure to be here on the show. So why heart disease is on the rise in Africa is because we're inheriting all these lifestyle diseases.
Yeah.
So what's actually happening is that indeed, as we're becoming more modern, what ends up happening is our diets are changing.
Yeah.
So there's more fast food in our diets, more processed food.
Yes.
The healthy foods that we eat on a regular, all the veggies, the good proteins are being replaced by more fast processed food.
Yeah.
And those foods are very, very injurious to the body.
Yes.
Then on top of that, what's actually starting to happen is we're decreasing how active we are. Because when you want to go for your job, what do? Either public transport or you have a car.
Yeah.
So, and then you'd have to ask yourself, are you exercising? Are you actually going to the gym or going for a run or doing some kind of activity that gets your heart beating? The answer to that is no. Then that's one of the reasons why we're seeing such an increase in cardiovascular diseases here in Africa.
So now heart beating, because in our heads, the heart is always beating. How fast must it beat for it to be like considered exercise?
So that's a very good question. There are different heartbeat zones which determine what exactly the benefits will be. Sometimes, in terms of the lower intensity range, that's usually a range where like it goes maybe around up to about 120 beats per minute. That's where you're doing good quality, essentially cardio, if you want to lose weight or burn fat.
Okay.
And then anything beyond that, that's for more intensive training. Either you're an athlete, you're doing endurance training, you're just trying to have your heart as strong as possible for whatever activities that you're doing out there in your life.
So now if I mean, the issue of heart disease is pretty serious. So how come we don't talk about it as much as we should? Is there a stigma? Is there fear of, what is the fear? Why don't we talk about it enough?
It's because heart disease is quite scary.
Yeah.
Like whenever I say the word heart attack, it just strikes fear into so many people. But the thing is, before we even get to a point where somebody is having such a major event, such as a heart attack, they're warning signs. And if we know these warning signs, and of course, if we're all educated about what these warning signs are, it's actually possible to prevent major cardiac events from happening. Yeah.
What are those warning signs like? Are they in numbers? And how do we find out? Yeah.
So I would say the best warning signs to know of, the numbers the doctors will take care of. I mean, I can speak about some of the numbers, but the major warning signs are mainly symptoms. So if we were to break it down with regards to what symptoms would predispose somebody to some heart disease of some sort.
Yeah.
The first one, chest pain.
Chest pain.
Okay. So if you feel pain right in the center of your chest,
yeah.
And the pain for the heart is usually quite characteristic. It usually feels like something is putting pressure on your chest. Like sometimes in the hospital, whenever we see a patient who's had a heart attack, we'll ask them, does it feel like an elephant is sitting on your chest? And they'll say, yes, Dr. That's exactly how it feels. So much pressure on my chest.
Yeah.
And that's usually the way the heart complains of pain. And then, not only just that central chest pain, but if you feel that chest pain and you feel pain going up the left side of your jaw, your left shoulder, or your left arm, then that is very indicative of cardiac pain. So that's so chest pain is usually one of the major signs. And then it's also important to know when that chest pain comes about.
Okay.
So if let's say you're doing your daily activities, you walk up a flight of stairs, and then you start to feel a lot of pain, that's a sign that, okay, it's time to go and see your physician or your cardiologist.
Okay.
Because what that means is that these cardiac events, or at least one of the biggest causes of heart disease, is what we call coronary artery disease, which is where I think people might have heard this term, atherosclerosis.
Yes.
This is where plaques build up in the blood vessels that give the heart blood.
Yes.
And as they grow over time, they can eventually block.
Yeah.
Yes.
Okay.
So that pain that we feel whenever somebody is having chest pain is because the heart is not getting enough blood, because its blood supply is being blocked.
Okay.
Yeah.
So this is different from the pain that someone might feel because they bench pressed more than they should. And because
very different.
The distinction. So it feels like there's pressure being pushed down on you rather than muscular.
Yes. The muscular pain is very different from cardiac pain. Although it's interesting because the heart is also a muscle.
Yes.
But it's a very special kind of muscle.
Yeah.
But of course, unless that pain, I mean, the only time you're going to be feeling that pain in your chest is if you're at the gym.
It's afterwards. It's afterwards because some guy got carried away and told you can do I don't know how many reps. Okay.
Yes.
Oh, that's actually quite interesting. It is interesting because I know a few people who have expressed that kind of pain.
Oh.
Well, when we come back on the Med Squad podcast, we'll be going into more detail, looking at some of the challenges to do with heart disease, but also distinguishing. Is there a distinction between men and women and others? Stick around. Hey there! Welcome to Zuri Health HQ, where Africa's finest medical minds meet modern care. I'm Yafesi, your host on the Med Squad.
Here, care is personal. It's not just diagnosis, it's direction. From a cough to managing chronic illness, we listen and we lead.
Every symptom has a story. We listen, explain, and act together.
Nutrition is not just about food. It's fuel, it's healing, it's prevention. We help you eat with purpose, for energy, for recovery, and for lifelong health.
We are not just lab coats, we are detectives, and your blood speaks when we translate.
Your mental health is not a luxury. It's your health, period. Whether it's trauma, depression, anxiety, or even wanting to speak to someone, we are here for you.
At Zuri Health, collaboration is our strongest prescription. We connect expertise across Africa to deliver care that is smart, affordable, and people first.
This is the Med Squad. Real conversations, real health, real people. From your inbox to your bedside, we're with you. Welcome back to the Med Squad podcast. Having Googled Fred Sanford, I hope you're having a good day, but we're right here with Dr. Tayo and we're talking about heart health and wanted to find out because we've talked about the gym and even some of the things that you mentioned, there's still in the back of my mind a stereotype that I've heard that heart disease is a man's disease. Is this true? Or are there statistics that say men are more predisposed to heart disease?
So when we do look at the the prevalence of heart disease, in terms of who suffers from heart disease more often, okay, I wouldn't go as far as to say overwhelmingly, but there is a higher predilection for men to suffer heart disease in comparison to women. And some studies have actually shown that some of the hormones that women make, principally being estrogen, actually has a cardioprotective, or it protects the heart to a certain extent.
Wow, okay.
That's why the amount of severe cardiac events we see in men versus women, in men, it's usually from the age starting from above 40, and then we tend to see cardiac events in women past menopause. So from around 55 to 60, around there.
Because that's when the estrogen levels are...
They begin to decline at that point.
Yeah.
But a lot of this actually, because once again, this is a lifestyle disease. It's not necessarily that men are unhealthier than women, but there are certain behaviors that men do more frequently than women. Excessive alcohol consumption, cigarette smoking. Those two are very, very harmful.
Yeah.
Then a sedentary lifestyle where you're not moving around much.
Yeah.
Then one of the things which partially affects men more than women, excessive amounts of stress.
Yes.
Stress is very, very damaging to the heart. And then one key thing I would actually really like to emphasize, and this is especially for the men, one of the reasons why ladies have better heart health outcomes is because they have what is known as better health-seeking behavior. And this is where, when there's something that you're worried about, go get it checked out.
Yeah.
Go and have a medical opinion on what it is. Because unfortunately, where the ladies do much better than the men is that when a woman has any minor issue, straight to the hospital.
Yeah.
Straight to the hospital. And then she'll answer whatever questions are needed. And some of these things can be detected early. Yes. But with men, we're like, oh, no,
I'm good. I'm fine.
I'll be okay tomorrow.
Yeah.
Let me just sleep it off.
Yeah.
And then weeks, months, even years can go by with having some of these symptoms, mainly the chest pain, even palpitations, difficulty in breathing, your legs are swelling. And then by the time you're getting to the hospital, it's either because you've had a heart attack, or your heart is failing, or something else is going on.
So it's really escalated by the time you're doing that. One of the things, we mentioned, because we do suppress a lot of emotion. We don't talk. We're not too honest about the things we're feeling.
Yes.
But when we hear it a lot that we need to reduce stress.
Yes.
And then you have environmental factors that really you can't avoid. The economy, pressure from family and children and all those other things. So sometimes men feel like we're in a corner.
Yeah.
So when it comes to reducing stress, how do we do that? How do we go about that practically? That's probably why they go look for alcohol and all the other vices.
Yes. It's interesting because to a certain extent, substance abuse is usually a coping mechanism a lot of the times to deal with the stresses of life.
Yeah.
But in terms of ways in which we can deal with that stress, the one thing I preach so much about, exercise.
Yeah.
Exercise. Be it weightlifting, be it any kind of cardiovascular exercise.
Yeah.
If you don't want to go to a gym, it could be playing football with your friends, or playing any kind of sport. If you want to go hiking, any of that.
Yeah.
Just something which, when the body feels good, the mind also feels good as well.
Yeah.
And you'll be way more equipped to deal with the daily stresses of life.
Okay,
then the other thing, talk. Like this silence that we tend to think is so noble as men is so damaging.
Yeah.
It's so damaging because it's really important that we are able to deal with whatever emotional, social, financial issues.
Yeah.
And sometimes one of the ways to deal with that is just either asking for help or just expressing yourself. Holding all that pain in, it manifests into something else. And unfortunately, it manifests itself in disease.
Wow.
So, and then it can also include other activities such as mindfulness, things like mindfulness, meditation, journaling as well. But I'd really just say developing a very good support system. Because as much as we men, we want to carry everything on our shoulders, like there's only so much that we can carry.
There's only so much.
There's only so much that we can carry.
And then there's another thing. Past a certain age, men find it very hard to make friends. So by the way, when it comes to playing football, just go to any place. You'll make friends very easily. They'll allow you to play even if they don't know you. But then with regard to, of course, the African challenge, a lot of men are in either informal or self-employed or in informal employment. So it's a daily wage. If I miss work today, I don't eat, or someone suffers, people who are depending on me. So how do we deal with access to proper care for men? Because we also fear, I'm going to line up for 7 hours, or I'm going to line up 5 hours and all. That for me is a practical hindrance to being what I'm expected to be, which adds to stress. It's like a vicious cycle. So access to proper care, what is available?
So one of the things which I can very clearly see, especially in an African context, is that unfortunately, a lot of the specialists tend to concentrate in the major cities. And I would assume this is the case in a lot of different African countries, where unfortunately, the different towns or cities are not as developed as, for example, the capital. And so most of the specialists who can diagnose and manage and treat these problems are very, very far away. So one of the things which definitely would help would just be building that capacity that despite you being in rural areas, you can still get access to quality care and to seeing a specialist. But now with the beauty of technology, what's starting to happen is now the rise in, for example, online consultations.
Telemedicine.
Where what essentially can happen is that, yes, it's always encouraged that you should go and see a doctor. The doctor should be able to clearly see you, examine you, listen to your heartbeat, touch different areas, just check your pulse, all of those things. But sometimes we can just make diagnoses based off of discussing. And so with telemedicine, the beauty with that is that I can speak to somebody in the most remote parts of any country, essentially, and they can tell me their symptoms. And unfortunately, I won't be able to examine them. But I can say, okay, based off of what you've told me, I think let's do this and this and this test. They're able to get the test done, and then I can advise them, okay, this is pointing towards this issue. We can start treating this. And the beauty is that they can do it from the comfort of their home versus having to journey, 6-7 hours to get to the nearest hospital if it's a very rural location. So increasing access to healthcare is so important.
And telemedicine helps with, even in terms of the issue with doctor to patient ratio. Because if one doctor is dealing with 10,000. So it does help. But now if you're to get practical, actually what we'll do, we'll come back and talk about some practical things that we can do in terms of habits that we can embrace with regard to preventative measures, because we do not want to be now carried by people when things are going wrong. This is the Med Squad podcast. We get candid about these conversations and we speak from the heart. No pun intended. We'll be back. Welcome back. This is the Med Squad podcast on the left side of your chest. That didn't work? Okay. Right. We'll go back to anatomy school and then you'll see what we're talking about. Anyway, we're actually talking about heart health and addressing the issue of heart disease in Africa. Why we don't talk about it, what are the factors to look out for, and also how we can prevent it. And Dr. Tayo is really helping us quite articulately, I might add, to get through this. And there are habits that we really need to get into. Let's call them heart healthy habits. we had obviously about exercise. Exercise is one thing. But now, say I get injured because I was overzealous and I bench pressed 200 kilos. And then now for a period, I can't do exercise, or it's not an option for me. Maybe I have a bad knee or something like that, or bad elbow, whatever it may be. What other healthy habits collectively, if we were to say a day in the life of a heart healthy person, what would that look like?
Okay. So what that would really look like is, number one, getting enough sleep. I think sleep is something which is not discussed about with regards to how important it is.
Yes.
I know everybody says, okay, if you go almost 3 to 4 days without water, you'll perish.
Yeah.
If you go almost, I mean, there's some people who've been able to go for a long period of time without food.
Yeah.
But if you go without food,
Like
once again,
a week plus.
yes.
Yeah.
But what we don't speak about is that we become very dysfunctional if we don't sleep,
Yes.
if we do not sleep well. Yes, it affects our mental health, but it's also important for our cardiovascular health as well. So at least 6 to 8 hours in a day of good quality, restful sleep.
Does it matter if you split it into like 6 hours here and then a 2-hour nap? Or does it have to be consecutive hours?
Ideally, consecutive hours would be best.
Okay.
No, I'd really say consecutive hours is the way to go, because because in that vein, it's almost like you say, okay, you can sleep, let's say from 12 midnight to 3 a.m. and then be up the rest of the day, and then you sleep for another 3 hours and you've gotten your 6 hours.
Yeah.
So no, consecutively is good. Naps during the day also helpful because they help re-energize you, help make you feel a bit rested, helps you to catch up on any kind of sleep debt. So yes, so wake up nice and refreshed in the morning. Then, so yes, exercise. So unfortunately, as you said, you had been injured by the 200 kg.
There are other ways of
bench press.
Yeah.
But some kind of cardiovascular exercise, at least what we usually advise our patients is at least 150 minutes per week of moderate intensity cardiovascular exercise.
Okay.
Yeah. So this, depending on your level of ability, this can be a brisk walk all the way to a jog. And if you can jog a bit faster, that's okay. But what I usually like to say is that the exercise should be intense enough for you to just get a little bit of sweat. Yeah. That tells us that you're working hard enough.
Oh yes.
Yes.
The sweat is good.
Yes.
So the corporates who like saying we'll rest when we die. Aren't they just accelerating the death?
Unfortunately, yes.
Yes.
Yeah.
Yeah. So kindly note, the ones who write the emails pursuant to our previous email telling me that we will rest when we die. No, that's completely out. We're not accepting that. So I wanted to get through some maybe fun trivia. Well, I don't know if it's fun because some people might think you're targeting me. Coffee. These stimulants that let's just address coffee itself. Is it good or bad for the heart?
So it depends on how sensitive you are to it. Yes, because coffee is a stimulant. What it generally does to a good number of people is it can cause the heart to beat a bit faster. There's some people who are very sensitive to coffee to the point where if they do have a certain amount of coffee or caffeine, it causes them palpitations. Yes. And usually for those individuals, we advise if coffee gives you palpitations, just avoid it. Yeah. But overall, I can't necessarily say coffee is bad for the heart. It's not.
Okay.
If you're sensitive to it, then it's probably best that you avoid it. But if you want to have 2-3 cups a day, that's okay.
Okay, fine. Caffeine is off, especially for those who are sensitive.
Yes.
Which also brings me to the ones who are not sensitive to it. You know, they can also overindulge because it doesn't have an effect on me.
Yes.
So is that also, or is it dependent on your sensitivity to caffeine?
It really depends on your sensitivity to caffeine. And it's interesting because you can actually develop what we call a tolerance to caffeine.
Yes.
Where for certain individuals, if I'm very honest myself, as a doctor with all the late nights and how much reading we have to do, I do enjoy my coffee.
Okay. It's okay.
But it's gotten to the point for me, because I'm such a habitual coffee drinker, that it doesn't give me that stimulant effect anymore. I now just drink coffee almost like ritual. Like if I'm about to start studying or if I'm about to go into clinic, it feels like it just stimulates my mind a bit so that I can be present.
Wow. So now that means you'd have to take some stronger coffee, Robusta, or is it Arabica? Which, anyway, you don't do the powder one, you do the brewed one. But then now also that brings us to the issue of food in general and nutrition.
Yes.
So in terms of heart healthy, there are lots of labels we see on products. This is good for your heart or heart healthy, and yet it might be processed. So now how do we really determine what is good for the heart and avoid the marketing gimmicks?
Yeah. So the rule of thumb I kind of use is that if it comes in packaging, which has complicated descriptions of what exactly the ingredients are on it, it's probably not good for you.
Wow.
It's probably not good for you. Because, for example, things like, let's say, vegetables, sukuma wiki, cabbage, onions, tomatoes, there's no packaging. Like, there's no packaging. It doesn't say, okay, this is what a tomato is composed of.
No sodium glutamate.
Exactly.
Triphosphate of some kind.
Exactly. So essentially just eating just whole foods. In the sense that, yes, a lot of fresh fruits and vegetables. Carbs is the one which is a bit interesting because the issue with carbs is it can predispose, if you eat too much carbs, it can predispose you to development of diabetes, of which that can then increase your likelihood of suffering from heart disease.
Okay.
So yes, a minimal amount of carbs, and then good quality lean protein. Yes, because those saturated fats that are present, especially whenever you fry foods or things like that, that's what finds itself in the lining of the heart, blocking the blood vessels going to the heart.
So lean protein, are we looking out for low fat or just portion control?
Both.
Yes, I'm eating low fat and then it's a small amount.
So I think a good thing that people can actually go ahead and look into, look up something called the DASH diet, DASH diet. It's a way which describes a diet that really helps. We mainly use it with lowering high blood pressure, because high blood pressure is also a risk factor for cardiac disease. Yes, but the fundamentals of that diet really help to outline a very healthy way of eating.
So you've mentioned actually risk factors. Which you've already mentioned diabetes and hypertension. So which are there others, or is there like something to look out for? Because someone might be thinking, I don't have heart disease. I was only diagnosed with something else, and yet that may be.
Yes. So there's some from all the research that has been done that we use to guide our practice of modern medicine is, yes, there are some very set cardiovascular risk factors which predispose somebody to developing the different forms of heart disease. So number one, men. Unfortunately, being a man is a risk factor.
Being a man, just like why not?
Being a man is a risk factor for heart disease.
Wow.
And then in men age over 40. Yes. From 40, as a general rule of thumb, 40 is the best age to start getting regular checkups, just to ensure that, cancer screening, checking your heart, checking your kidney health, your liver, etc. Because we usually see a lot of chronic diseases tend to start from the age of 40.
Men over 40. First of all, I feel attacked, but it's okay.
But for the ladies, it's postmenopausal ladies are at increased risk of developing heart disease. Then we have certain conditions. High blood pressure, which, as we had talked about earlier, high blood pressure is also on the rise in Africa. And together with that, type 2 diabetes, which is also on the rise here in Africa.
Okay.
Then there is also having elevated cholesterol levels.
Yes.
So that, well, let's just say when you do go to the hospital and your doctor does something called a lipids profile to check your cholesterol, there's the good cholesterol, bad cholesterol, etc.
Yeah.
They tell you have high cholesterol, then it's very important that we start treatment to lower it. And then on top of that, if there's a strong family history of any cardiac disease,
yes.
so if they've been anybody in your family who suffered from what we call a sudden cardiac death, which is where unfortunately they just collapsed, and it's because the heart just suddenly stopped working.
Yeah.
Any relatives who have had previous heart attacks, because it means that there's a certain genetic predisposition to developing these conditions.
Yeah.
And then the other major cardiovascular risk factors include an elevated body mass index. So if you're approaching the levels where we'd say you're clinically obese, so whenever you go to your doctor's office, they'll take some of your vitals, and part of that includes calculating your BMI. So that's also a high BMI is also another risk factor. We say from about 25 onwards is where the risk increases.
Okay.
And then excessive cigarette use is very, very the incidence we see of people suffering from cardiac disease who smoke is very high.
Yeah.
So if there's one thing which I tell anybody to stop is smoking cigarettes. Yeah.
Does that include vapes?
Yes. Just any substance that you're inhaling deeply into your lungs.
Yeah.
The only thing your lungs were designed to tolerate is just normal air.
Yeah.
That's the only thing. Anything else, it just irritates it. It causes so many different problems.
Okay. With regard to tests, because of these underlying conditions, because there are children who also tend to experience heart disease. So what is the process for testing? How do you do tests?
Yes.
To find out whether or not I am either heading in that direction or I have a problem.
Okay. So, and it's a very good question that you've asked this, because what I'd actually encourage most of our listeners is that if you are worried about your heart health, that the next time you do go see your physician or your cardiologist, just request that they actually check you for some of these things, or you can go for an annual wellness checkup. But what some of these tests include, so we'll do a full hemogram where we check all the parameters in the blood.
Yeah.
And the major thing we're interested in looking at is your hemoglobin levels. Then we'll also perform kidney function tests.
Yeah.
Because the kidneys and the heart are very closely linked. When the kidneys have problems, it will cause the heart problems. When the heart has problems, it will also cause the kidneys problems.
Oh.
Then there's a very important test that we do called troponins.
Troponins.
Yes. Now, I won't get too complicated.
You can trust me. Go ahead. You asked.
But there's a certain protein that's in the heart muscle cells called troponins. And when the heart is getting damaged, it releases those troponins into blood. So one of the ways in which we diagnose someone with a heart attack, for example, is we'll do a troponins test, and it comes back very high.
Yeah.
And it tells us that, hey, the heart is unfortunately dying and it's releasing this substance into the blood. Then there are also some very key characteristic cardiac tests that we do. So I think anybody who's watched any medical show has seen that line that goes like that.
Yeah.
Yeah. That's called an ECG.
Yes.
And it's such an incredible piece of modern medical technology.
Yeah.
What it does is we'll stick some electrodes onto the body.
Yeah.
And we'll actually measure the electrical activity of the heart.
Yeah.
Because the way the heartbeat is coordinated by using certain electrical impulses in different places.
Yeah.
And it's actually even one of the ways that we diagnose a heart attack. Because if part of the heart is dying because it is not receiving enough blood at the time, the way the electricity moves through that point is different. Yes.
Hey, do we have enough of those machines around the country? Or do we need more?
The major thing is access.
Access.
There, I know there's some great companies that are working to make more portable ECG machines, because some of the ECG machines I've used are gigantic.
Yeah.
You have to push them around.
Yeah. So you can't just put them on a drone and send them elsewhere.
So with these newer ECGs they're designing, it's almost like just like a small box with a printer. It has everything it needs to measure everything on the chest. And it just prints you a strip, and you can make a diagnosis like that.
Okay.
So there are people who are working on a lot more accessible medical technology, let alone just access to healthcare.
Yes.
Then on top of the ECG, there's something called the echocardiogram. So what I think the best way I can describe this is, you know how...
So ECG, the first one is
electrocardiogram.
So this one's echocardiogram.
Echocardiogram.
Okay.
Yes. So I think the best way I can describe it is, you know how when ladies are pregnant, they go for their regular ultrasounds to look at the baby and everything.
Yes.
This is now an ultrasound, but specifically for the heart. Yes.
Wow.
And it allows us to see how the heart is moving, how much blood the heart is squeezing out, if there are any issues with the valves in the heart. It's really
like
amazing.
Live, you're watching the heart at work. And
I do them myself all the time.
Wait?
Yeah, so it's really fascinating stuff.
It's quite a trip.
Then
yeah.
So it's just important so that when people, if anything, it would be good that people go to the hospital and say, hey, I'd like to have my yearly echocardiogram done. Then another important test is also something called an exercise stress test. Now this we usually order when now we're worried that you might be having some ongoing blockage in your blood vessels for the heart.
Yes.
Because remember how we were talking about how sometimes that kind of characteristic cardiac pain. So there are times where the pain comes when you start doing activity.
Yeah.
Because what that shows is that because of that blockage, when the heart starts becoming active to compensate for the activities of the body, it needs more blood.
Yeah.
But because of that blockage that's slowly building up there, the heart isn't able to get as much blood as it needs when you increase your activity.
Yeah.
And so what happens, and this is a very important thing for people to know, is that if you get chest pain, when you start walking upstairs, you walk a long distance, and then you stop, you rest, the chest pain goes away completely, that tells us there's some coronary artery disease that needs to be looked into.
Wow.
And so what this exercise stress test is we put the electrodes for an ECG, and then we ask the patient to walk on the treadmill. So we're trying to stimulate that activity that causes the heart to require more oxygen.
Yeah.
And if the heart is not getting more oxygen, more blood than it needs, once again, it complains either with pain.
Yeah.
So the person on the treadmill will tell us they're feeling pain as they're walking.
Yeah.
Or the ECG will show us, okay, this part of the heart is not getting as much blood as it should.
Yeah.
Yeah.
Goodness, the technology is pretty amazing.
I mean, I could. There's still a couple more I could tell you about.
Yeah, please tell me everything, because by the end of this, you'll give me a certificate, and I'll follow you and be your assistant.
Yes, you'd be trained. You'd be fully trained in cardiac preventative medicine.
Hey.
Then there's also another test called a Holter. A Holter, a 24-hour Holter monitor. So what can happen is that an ECG only records the electrical activity for the heart just for 10 seconds. Yes.
Okay.
So it's like, imagine it's like taking a picture of what the heart is doing electrically for 10 seconds.
So it's the TikTok of heart machinery. Yeah, okay.
That's such a great way to describe it. But now, for example, if somebody is having palpitations, where a lot of the times palpitations are because the electricity in the heart is doing some unusual things.
Yeah.
And the palpitations sometimes can come on and off.
Yeah.
What that Holter is is it's a ECG that you walk around with for 24 hours. And should you have any palpitations while you're wearing that halter, when a cardiologist looks at it, they'll be able to tell, hey, at 3 a.m., this individual had an unusual cardiac rhythm, and this is dangerous, and we need to do something about it.
And then do I have to give a report of what I was doing at 3 a.m.? Right, because unless it has a camera, I don't know.
I mean, if those palpitations keep coming at random points at night, yes.
You let us know.
It would be important to know what you're doing. And then these are the last two which I'll talk about. So they're actually CT scans which can actually look for any deposits of the plaque or the atherosclerosis in the heart.
Yes.
So it's called a CT scan, coronary angiogram, with something we call a calcium score.
Yeah.
Yes, because if calcium is finding its way into those deposits, it tells us that it's significant. And it's something which we need to look after.
Okay.
And then the holy grail of cardiac procedures is now what we call a coronary angiogram, which is an invasive procedure where a cardiologist will introduce some wires through one of the arteries, either in your wrist or in the groin. And they'll thread that wire all the way until they get to the heart.
Am I awake at this time?
You'll be talking to them, fully awake. You've just been, the thing is, you'll be given some local anesthetic so that you don't feel pain here.
Yes.
And once they're in the artery and they're going to the heart, you don't feel anything.
Okay.
And what that allows cardiologists to do is that in real time, using dye, they can actually flush dye into the vessels of the heart and actually see where the blockages are. Yeah.
Wow.
So by the time a cardiologist is telling you that you need to do a coronary angiogram, it's because they're quite worried that something either can be addressed to prevent something in the future from happening, or something is currently happening and we need to see, okay, so usually this would be in the context of somebody's been having a lot of chest pain for a long time, or they've come with a heart attack. And we need to see, where is this blockage?
Yeah.
You'll be sent for a coronary angiogram.
Okay.
And then I could keep going on.
What I'm wondering is, as you keep going, there's the calculations in my head. Is this covered by insurance?
So yes, it actually is covered by insurance. Although, okay, let's just redo it again. Let me think. What can I say about that?
Or is it some insurance covers?
I'd say a higher end insurance covers.
Okay.
It's the main thing.
So like premium ones.
So yeah.
So then,
although
the national,
to be honest, let me not speak.
Yeah.
I do know, because like, for example, at work, like before NHIF changed to SHA, NHIF was covering a certain amount. Okay, so they won't cover the full cost of it, but they'll cover some of it.
Okay.
Yeah.
That is helpful.
So I think what I can say is that it depends on which insurance that you have. There's some insurances that will cover or allocate a certain amount, and then you have to top up, and there's some insurances that will cover everything.
So you have to actually ask your insurer.
Yeah.
You just ask them questions.
Yes.
All right.
So I think we can take it back from there again.
So okay, we do that again.
Yes.
Yeah, so that we get the right information. Okay, so I mean, you've listed many tests and you could list some more, but I'm thinking in my head, the costs coming in, is it covered by insurance, or how do we deal with this?
Yes. So it is covered by insurance, but it depends, what I would say. Because it's very important to discuss with your insurance provider what they would be able to go ahead to cover from you. Because in my experience, I've seen patients pay cash for all of these procedures. Then there are some insurances which will allocate a certain amount of the procedure.
Yeah.
So they'll assist with, let's say, 30, 40, 50, 60% of the cost of the procedure, and then you have to top up. And then if you have a very good quality insurer, they can cover the cost of the whole procedure.
Okay.
Yeah.
Well, that's actually reassuring.
Yeah.
But you have to ask questions. You have to ask. Now,
Yes.
as we bring it to a close, there's something else that I want to address. Laughter.
Mhm.
First, there's laughter. Is it genuinely good for the heart? And then heartbreak. Can heartbreak be detected scientifically? Yes.
Okay. So is laughter good for the heart?
Yes.
Yes.
Ah.
Yes, it is. Because laughter releases a whole bunch of feel-good hormones,
Yeah.
of which those help to lower stress. Lower stress levels means less inflammation. Because a lot of these conditions are actually driven by inflammation.
Yeah.
And stress is something which is very pro-inflammatory. So when you laugh, when you're happy, it actually does make you healthier.
Yes.
Yeah. You never see somebody who's happy laughing in the hospital. Okay, maybe if it's a comedian. But
you find them there. Yeah.
yes. And then heartbreak detected scientifically, this is an interesting question. There is a condition in medicine known as Takotsubo's cardiomyopathy.
Takotsubo's cardiomyopathy.
Takotsubo's cardiomyopathy.
Hey, 12 marks if you can remember that. Takotsubo's cardiomyopathy. Okay.
And it's a very temporary heart issue that occurs after a highly stressful emotional event.
Okay.
So one of the ways in which people can or know it by is, like, for example, the pain of heartbreak.
Yeah.
Some people can actually get hospitalized because after having their heart broken, their heart physically becomes weaker for a temporary amount of time. And then with treatment and with whatever kind of support that's needed for the person to regain their strength, it goes back to normal. Yeah. But it's not only just with heartbreak, it can be with things like grief, it can be with job loss, it can be with just anything that is such a stressful event for somebody that it goes ahead to actually affect the heart.
Wow.
Yeah.
Hey. Do you have any final words about heart health, that something you'd advocate for, or something you want to leave in our minds?
Yes.
I mean, this is a muscle that beats, like, how many times a day? 100,000 or something, I don't know.
We'd have to do some mathematics.
We'd have to do mathematics, yes. But yeah, are there any thoughts you'd like to
I think the major thing that I would like everybody to take away from this whole conversation is the importance of prevention. Because it's very, very unfortunate for me as a doctor when the first time I'm meeting a patient in the hospital is not for a routine checkup, it's not for something that can be dealt with in a simple clinic visit, but it's instead when they've had a heart attack.
Yeah.
And from what we know, heart attacks don't just happen. Heart attacks, the buildup of plaque in the blood vessels for the heart, the coronary artery disease, is a process that takes years. And there are usually symptoms that are associated where, as I described, you get the chest pain when you're walking, when you're doing any kind of activity. You feel it going to your shoulder, to your arms.
Yeah.
You find that there are random times now when you're resting, you suddenly get that chest pain and then it goes. And then eventually that blood vessel blocks completely. And that's when you have a heart attack. But because this can be detected early, if you come for checkups, then we can prevent very catastrophic cardiac events from occurring.
Yeah.
So once you pass the age of 40, regular checkups, please.
Okay.
Like just at least once a year. Just book one day. Just give yourself the whole day. It might take a while. You'll have to wait for a lot of lab tests. You'll have to be in the hospital.
Yes.
But after that one day, you can go home with a clean bill of health that the doctor has told you, I'm going to be okay.
Yeah.
Yeah. And if there's something that they found, it can be dealt with very easily.
Yeah.
Yes.
Wow. Thank you for that advice. And you've heard the advice, I'm sure. If you didn't hear the advice, just go back to the beginning of the episode, listen to it through all the way to the end. This is the Med Squad podcast. If you follow these instructions, to quote Celine Dion, your heart will go on. Follow us on @the_Med_Squad_pod on all our socials. Please share this episode, share this information with someone who needs it, and also go over it yourself so that this information is embedded, not in your head, but in your heart. We'll see you next time.